We get a lot of questions here at RSI Help YouTube, and one of them recently was, why do my forearms hurt? And this person was talking about swinging a hammer. But you can get forearm pain from lots of different things, including using a computer keyboard. So here to answer these fascinating questions, such as why do my forearms hurt, is our chief medical expert, Dr. Robert Markison. Welcome back to the show, Dr. Markison. What can you tell us about sore forearms?
Well, I'm going to fire back one question. How long has it been hurting? I mean, in the natural medical history taking framework, you ask, where does it hurt? How long has it been going on? What is your scope of activity? How did this all begin? Out of the blue? Or were you swinging a hammer? So give me a for instance history real quick.
I would hazard that this person, it crept up on, and he hasn't really verbalized. And it was just one thing that sort of came up in conversation, but things don't come up in conversation unless there's a reason. So I suspect it's been going on for a while. I suspect a not polypharmacy, but polyactivity, you know, like swinging a hammer and using a computer and playing guitar. That's what I would
Okay, fine. And then it's a question of which surface. Is it the extensor surface or is it the flexor surface? The power comes from flexors. The extensors are very weak and they're only in place to position parts to ready them for action because you're seldom really resisting extension. So these are the positioners. They're quick. They're running close to the axes of rotation of joints, meaning they have short moment arms, meaning that they are quick and weak. These are big, strong, slow. They're spaced farther away from the axes of rotation of the joints, meaning longer moment arms. And in terms of simple physics, they're going to be very strong. They're going to be slower. And so they'll tolerate more abuse than the extensor surfaces. And the blood flow per unit tissue on the top extensor surface is not quite as good as all the wonderful red meat here with good circulation in the muscle mass, which becomes tendons with less blood flow and so on out here. But it's then the question of where do you hurt? And if you're hurting on the extensor surface, you're straining muscle origins, maybe the bony prominence that they come from, the common extensor tendon, and the why is just overdoing it and abusing an extensor, which is a positioning muscle, and either resisting too forcefully too often or having sustained wrist extended positions in these weak muscles that are going to react by inflammation. And you look under a microscope, you're not going to find inflammatory cells, but you'll feel the burn and feel some pain that may radiate up and down. But the why is you're abusing weak, fast muscle tendon units on the top, extensor surface. If you're overdoing it on the flexor surface, then it's not only too much power and forceful gripping, but it's also speed. And in my practice, you know, since I first published 30 years ago in ultrasound diagnosis and later ultrasonographic treatment of hand problems, it's very informative. And so I'll look under ultrasonography in real time and educate both of us in terms of me and the patient, in terms of how things work, the origins of muscles, when they become tendons, how they move, whether they're dependent on each other, interdependent, and so on, anatomical variations out to here. And it actually gives the person pause in terms of why would I overuse these moving members? And so if you're swinging a hammer, how heavy is the hammer? Is it too heavy? Is it too light? Could you be using a pneumatic tool to drive a nail in? These are simple questions of instrumentation. And so if you're hitting the keys on a keyboard, how hard are you hitting them? Is it something that's a whisper or is it something percussive and unnecessary? And the why is also the transmission of force, which is again amplified as you go from thumb and fingertips upwards. So we've talked about the thumb before, 1 pound here equals 10 to 12 pounds here. And similarly, as you go up the digits, increasing the force that's transmitted in order to make something happen out here, there's a fair amount of force here. And so overusing it, over gripping, rapid cycling, tension, inadequate blood flow, microcirculation, cold hands, always checking the temperature on your cheeks to make sure they're warm, and then you're fit for work. Otherwise, you don't have enough inflow, outflow, circulation, and good balance to move these things. So the whys also relate to nutrition. Sounds odd, but as a hand surgeon, I have to think of all the variables that come together, and 50 to 75% of indoor dwelling humans now have blood measurable D deficiency. And so since every cell in the body, 3 trillion cells, 86 billion in the brain, have D receptors, it's more than a hormone. I mean, it co-regulates 5% of decoding the human genome. Vitamin D is a big deal. So a minimal vitamin D deficiency is going to be more aches and pains. We've also spoken about medications in the Y category, and there are a fair number of medications that can cause tendinopathy, arthropathy, meaning joint inflammation, and other musculoskeletal inflammation. And I had a patient last week whose hands felt somewhat paralyzed, stiff, and painful. And I just said, "What antibiotic are you taking?" He said, "I had a course of Cipro." I said, "Well, this is Cipro tendinitis, tenosynovitis. It's a drug you may take if it's the only drug that will kill the bacteria. But otherwise, you're having kind of a musculoskeletal in addition to a microbiome shutdown. And it won't get better until you repopulate the gut with hand body friendly bacteria, probiotics, prebiotics. Nothing good will happen until your D levels are up in the 50 to 80 nanograms per ml range and so on. Nothing good will happen until diabetes is controlled, hypothyroidism adequately supplemented, so on, so on. So this sounds like we brought in an array, but it's all part of the calculus of why does it hurt? We talked about mechanics, biomechanics, but it's also a constellation of variables that should be addressed to get you out of trouble and keep you out of trouble.
And this is why we have Dr. Markison answering these questions, because he takes such a broad view, and the body is one thing and it's all connected and can't leave anything out.
No, be nice to yourself and take your 3 trillion cells out to lunch once in a while.
All right, Dr. Markison, I want to thank you so much. Unless there's anything else you want to add, we're going to sign off for this episode of RSI Help YouTube. And I really want to thank you on behalf of all of our viewers. You're getting so many nice compliments from people about these episodes. So thank you from me and from them.
Glad to be with you.